All right, for those, again, who are watching, we're just waiting for one additional member of our team to get logged on. And just as a reminder, hit the share audio and video button on the bottom of your screen if you want to be in the roundtable. If not, you're welcome to just listen as well.
Okay, that's better.
There she is. Hi, Kelly.
Hi, it says David Summers at the bottom, but I'm obviously not David Summers, so.
Okay, it's all right. It even has your whole title there. All right, well, should we get started? I think we've got a couple people watching. So my name is Melissa Evans. I'm the managing editor here at the Long Beach Post, and I'm going to let Jeremiah and Kelly introduce themselves real quick. Why don't we start with you, Jeremiah? Is he there?
I think he froze. Oh, okay.
Oh, we can't hear you. You know what? I think our Wi-Fi is getting taxed pretty badly here.
Yeah. Okay. We're having technical issues.
Yeah. Okay, hang on. Jeremiah. All right. Sorry, Jeremiah, are you back? Go ahead and unmute and introduce yourself. Oh, we still can't hear you. All right, well, Kelly, why don't you introduce yourself?
Hi, I'm Kelly Puente with the Long Beach Post, and I cover I'm general assignment, special projects, do a little bit of everything, and I've been doing a lot on COVID coverage, obviously, this past year, and vaccine rollout, too, so happy to be here. And thank you for joining us.
Hi, I just wanted to pop in because you're Kelly, and I see you've got David Summers on your screen, but I just wanted to let you know that we fixed that other issue. But yeah, and that if Jeremiah is having trouble with the audio visual or the audio portion, I would just refresh and try to join again with that button at the bottom. Hopefully that will work out.
Okay.
And just a reminder for all the folks who are watching right now, if you want to be part of the conversation and do face-to-face, you can click on share audio video and get yourself set up to be part of the conversation. Thank you.
Thanks, Elizabeth. I think Jeremiah is working on joining us. Oh, now he's a spectator. Okay, he should be here soon. So just a little background on myself. So I'm the managing editor here at the Post and also the Business Journal. And as Kelly mentioned, we've been doing a lot of coverage of COVID, obviously, for the past year. It's been the big story. And we're at an interesting juncture at this point. Ever since vaccines were made available in December, there's been kind of a glimmer of hope that we can start getting more businesses opened. The vaccine rollout came right at the height of the winter surge. We were seeing lots and lots of cases and hospitals being overwhelmed. The death rate was starting to climb and continue to climb in January and February. And now we're really seeing the bottom of that spike in COVID cases and hospitalizations. So there's a lot of hope right now that we're kind of past this big wave, but it's been quite a logistical feat for the city and for the county and for the state to roll out this vaccine program and get eligible groups, deciding who's eligible, get everyone vaccine according to who's first in line. So we're going to be talking about the rollout, what's happening here in Long Beach and what's happening in the county as well. And before we start though, Jeremiah, you're back. Why don't you introduce yourself? Oh, what? We still can't hear you.
And his volume is up and on and everything? Oh, man.
That.
Oh.
No, still no.
Yeah, now we can a little bit.
Oh, you can hear me now. Okay. Yeah. I just had to switch my microphone. Sorry.
Okay.
Defaulted to the wrong thing. So, but hi, I'm Jeremiah Dobrik. I'm the breaking news editor at the Long Beach Post. Usually that's crime and courts and stuff, but breaking news has included lots of coronavirus and vaccines, just like all news coverage has these days.
Yeah. All right. So, and we can, for those of you who are watching, listening, if you guys want to jump in with questions or with comments, that's great. Or if you want to add questions on the live chat too, we can talk about more specific topics as you guys want. But why don't we start with you, Jeremiah, and just talk about kind of where we're at right now with the vaccine rollout here in Long Beach.
So big picture or little picture, there's a couple different things going on right now. So big picture, obviously we are in the middle of trying to get hundreds of thousands of people vaccinated, and we're making progress toward that. In Long Beach, it's something around 22% of adult residents have been vaccinated. That's pretty comparable to the rest of LA County. Of course, it depends a lot where you live and who you are. But if we're talking just broad strokes numbers, we're almost a quarter of the way to vaccinating all adults who can get the vaccine. Of course, kids can't get it yet. But
as of Monday, we're at 26% for people 16 and up. So more than a quarter now.
Which is pretty crazy, considering where we were just a few months ago. If we're looking smaller picture, kind of this moment in time, which is the kind of stuff I've been covering lately, is just the day-to-day, how is this working? The city of Long Beach, which kind of has been ahead of the rest of the county and state in a lot of ways, just switched over to a new vaccine appointment system. And there's been some hiccups with that lately. There's a big kerfuffle downtown the other day where there were just massive lines around the block because the state had accidentally booked way too many appointments at the convention center, so they didn't have enough vaccine and people had to be turned away. So we are making progress, but all those kinds of details are still getting sorted out and happening on a day-to-day basis. We're still having glitches and hiccups like that as they're kind of figuring this out as they go along.
It's been kind of interesting too, just from the beginning of this process, because I don't think in my lifetime, at least not as a reporter, we've ever encountered a situation like this where we're presented with a deadly virus that we don't quite understand. Or we didn't at least a year ago. And first it was trying to get a test created to get, and getting that distributed, and having the city kind of roll out, testing sites all over the place. And also in the very beginning, trying to figure out who should get tested. I remember early on, they were saying, not everyone, if you have symptoms, just quarantine. Because they just simply didn't have enough tests. And now we've got this vaccine, which could potentially save people's lives. And it's been interesting kind of watching the process of them deciding, I mean like the state and local health officials deciding who should be first in line. So either of you, Jeremiah or Kelly, you want to talk about kind of the process of how they figured out who should be eligible and when?
Sorry, I hope you can't hear the sirens.
You can tell we're all in the same building.
No, it's been an interesting process for the state and Long Beach to decide who gets it first and when. And in many ways for Long Beach, this has been a success story because this is one of the areas where it's really shown the benefit of having our own health department. We're one of 3 jurisdictions in California. The other was Berkeley and Pasadena that have their own health departments. So we were able to target this. And then the governor has been down here, two, 3 times now, lauding Long Beach for its rollout and giving us special permission to move forward. So, we've been able to bring other groups in earlier than than nearby counties. So it's interesting to see.
And I think, Melissa, your point about testing is really interesting because I keep thinking about just how much we agonize and how much scrutiny goes into every little decision like that. I remember writing a story back when this was all starting about how they were turning people away for testing. And they basically said, even if you have it, even if you were exposed, even if you have all the symptoms, unless getting a positive test would somehow change your treatment, don't even test them. Just assume.
If you have light symptoms, just stay home. Don't bother. Yeah.
And that coming from that level of scarcity to now, where there's dozens of places you can walk up and get a test, is just night and day. And I don't think we talk about that. And I actually think we're going to be on the cusp of that pretty soon with the vaccine. We're at a point with the vaccine where we're all agonizing over every decision about who gets which shot, and that is going to change pretty soon, I think, just like it did with testing.
It's already opening up really fast, because especially with the opening up to people with underlying health conditions now, the state is actually not even requiring any proof of your underlying health condition. And that makes sense for people, who are undocumented or have asthma, or they're citing, medical HIPAA issues. So now anybody can really go up to a testing site and make an appointment, not a testing site, a vaccine site, and and having made an appointment saying they have an underlying condition, and they don't have to ask any questions. So really, it's anybody who wants one at this point can get a vaccine.
So initially, in December, the first group that they identified as a priority group were healthcare workers, because the fear throughout this entire pandemic has been preserving and protecting the healthcare system. They did not want the hospitals to get overwhelmed, and that's when things got kind of scary in December and January, when the hospitalizations, that number was so critical to our daily, the daily numbers we were getting, because you don't want a situation where doctors and nurses are having to decide who lives and who dies. And we didn't get to that point here, thankfully, but that's always been kind of the focus, I think, of the response, is making sure that we preserve the infrastructure of the healthcare system. So the first priority group,
I think
we lost Jeremiah. So the first priority group was the healthcare workers, the doctors and nurses. And then after that, they started vaccinating like paramedics, people who were on the front line, but not necessarily in hospitals. And then Kelly, correct me if I'm wrong, I think the next group that became eligible right after healthcare workers, at least here, was seniors over 65.
Yes,
Is that right?
January? People 65 and over. That was the next group right after the emergency and healthcare workers.
And the reason for that, we listen to these, we've listened to so many of these media briefings by the county and the state, is because that group, that over 60 group, has the highest mortality rate of any group by far. Just here in Long Beach, more than 80% of all the fatalities we've seen in the city have been among people over 60. So they really wanted to, they made clear that it was their preference, well, they wanted to preserve life.
Well, it caused some chaos, because initially that group was not, further up on the tier, and they switched it around and said, okay, now we're going to have people 65 and up. And a lot of places were scrambling, like LA County, and saying, we don't have the capacity or vaccine levels to vaccinate all these people. And Long Beach was like the first jurisdictions to be able to accommodate that and do that for 65 and up. So it's been a lot of, the state changing things up, and jurisdictions like Long Beach having to scramble for the latest, changes in the tiers.
I think you definitely have to look at it as there's been two different tracks of prioritizing who to vaccine. You have obviously the vaccine of the choices of, this is to preserve life. And that's what you're talking about. The healthcare workers, you're talking about the people over 65, and you're talking about people with underlying health conditions. But then there's also this other track of economic interests, where you're talking about essential workers, people who have to go to work every day, and things like in Long Beach, we had port workers kind of get thrown in with food workers. That there was actually some lobbying of the state to allow Long Beach to start vaccinating those workers. And there's a health interest in that because those people do have to go to work and keep working. But really there's an economic interest there too, where you have to keep society functioning to some extent. So I think you kind of have to look at it as two different tracks of decision making about who's going to get the vaccine and when. Of course, I think we're almost past that. And it's going to open up, like Kelly said, anybody who wants to get a vaccine can probably figure out a way to get it at this point. And we're going to be moving into basically convincing people to get it pretty soon.
Well, there's that economic interest, but also the strong lobbying groups. Like you have, arguing why were dock workers able to go first? I'm a UPS driver. How come I can't get it? Or, Amazon drivers and all these different groups are, saying, well, we should be, everybody wants to be in the front of the line. So it's been interesting to see how certain groups are getting it. We were talking earlier about faculty, at community college or at universities where they're teaching, from Zoom and maybe not as high a risk. So it's been tough and I wouldn't want to be in the state's shoes having to figure out, well, this group goes first and this group goes first and who's more at risk. It's tough decisions for sure.
Yeah, and I should clarify. Technically, everybody is not eligible right now.
Yeah, we're not saying go down and get
right.
If you're not,
probably figure out a way.
Thing going on. Yeah, we got ethical. Yeah, I'm not eligible yet. So
right. So what are the groups? What are the groups that are eligible according to the books now?
People with disabilities, physical and mental, people with underlying health conditions, and that underlying health condition umbrella is very broad. You can go. I think you're, ideally you're supposed to work it out with your healthcare professional, your doctor, to determine if you are eligible. And food, grocery workers. I do know. It's a little. I mean, I know some. I think people working in communications, like. Entertainment industry and our group is media is coming up next. Not eligible yet,
yes.
But that's one of the.
I think they are coming up next. Yeah.
Mm-hmm.
I think we're soon, but we're after educators. It's up to educators right now. That's really a critical component too, is getting schools open, which is actually going to happen starting March 29th in Long Beach.
And Long Beach is actually is through vaccinating all of its. Everybody in the education sector that wants one is able to get one now, which is a pretty amazing feat. They did that quickly. I was surprised how we've been able to roll through it.
Well, and one of the data points that we're missing that will be interesting to see, that's been difficult to get from the city and other health jurisdictions, is the uptake rates. Like, yes, every educator in the city has been given an opportunity to get the vaccine. We don't know how many took that opportunity. It could have been 100%. It could have been who knows.
Yeah, we were seeing that with some of the healthcare professionals in some jurisdictions. It was like only half or 16% were choosing to get the vaccine. It was interesting.
And the hard part is kind of divining what kind of long-term impact that's going to have, because now we're at a point where we're very quickly moving into reopenings, thanks in part to the vaccination rates. Like the more people that are going to get vaccinated, the slower this is going to spread, obviously. But does that stall at some point? Do we get stuck? We just moved from the purple tier of the most restrictive coronavirus restrictions to the red tier, which is why we can open up some indoor dining, theaters, a few other things. And we're actually, our statistics, our metrics on case rates and the positive rate of tests is good enough that we could move into the orange tier, which is the next level of loosened restrictions, in a couple of weeks. So we haven't really seen this stall or this plateau yet where things aren't getting any better, but you do have to wonder if that's going to happen, if there is a certain segment or portion of the population that's just not going to get vaccinated. Are you going to see this lingering low infection rate that just sticks around forever?
Yeah, I was thinking about that this morning because I was looking at it's been amazing to see the positivity rate, the rate of people testing positive just drop every day. And today, and it, yesterday it dropped below 2% for the first time. It's actually the lowest it's been since the start of the pandemic. I was wondering, I'm like, how much longer are we going to see it drop to zero? Like 0 people are testing positive. It'll be really curious to see what happens over the next week, because every single day it's been dropping consistently. So yeah, at what point does it plateau?
I mean, that's
go away.
That's the goal, right? Is to get it to 0. And then I guess, you go from purple to red to orange to yellow. I guess 0 would be green and things are back to normal. I mean, that's really the big long-term question here, though, is does it go back to normal?
Yeah, and I'm sure we are reaching, just for perspective. So Long Beach has about 460,000 residents. I'm just going on to the Long Beach vaccine site right now. And we've had a little over 50,000 cases of coronavirus in Long Beach. So about 50,000 people have actually had the virus. Presumably probably have some immunity to it at this point. And the city is showing that just over 96,000 people have been vaccinated here, and that's just residents. So, I mean, we're probably getting towards some herd immunity with the number of people that have actually had COVID-19, and now the number of people that have been vaccinated. Not yet 50% of the city, but getting there.
Do we want to talk about the disparities in the
Oh yeah, for sure. And that actually goes along with what we were talking about earlier about people not wanting to get the vaccine. So talk about that, Kelly, about efforts to reach some of these hard hit communities.
Sure. Yeah, we've done a few stories on this because this is a major issue in not just Long Beach, all over the state, LA County. And what basically we're seeing is it's pretty startling when the city started mapping the zip codes that were getting the vaccine. And if you look at it, the city of Long Beach, the zip codes that have the vaccine, to the right, it's all dark purple, showing that the higher rate. And then to the left, at the west side of the city, it's all light purples. So it's all the people in the more affluent areas, the east part of the city, are getting the vaccine. For example, Belmont Shore, 90803 zip code. As of Monday, 32% of residents in that zip code have had the vaccine. The death rate is the lowest death rate in the city. So here you have an example of a zip code with the highest vaccine rate and yet lowest death rate and one of the lowest infection rates. And then you have the zip code with the highest infection rate is North Long Beach and Central, and they have my computer just freezed up, but they have the lowest rate. It's a huge
Sorry.
Here it just came back up. I have a lot of technical difficulties today. The 90813, that's Central Long Beach. That's right, just north of downtown, very central. Their vaccine rate is 11%. So, 3 times higher. And then they have one of the highest death rates and infection rates. So it's amazing the disparities you're seeing here. And there's a lot of reasons to that. One of the reasons that the city and the mayor has emphasized is that most of the people getting the vaccines have been people over 65, and those people tend to be white and live on the east side. So there's going to be a natural, inequity there, just looking because people are younger on the west side. But that doesn't explain all the disparities going on.
What is the reason for that? Or what have health officials said about it?
Well, health officials have said there's multiple reasons. One, it's access. People in the inner city and people low income just have less access to technology. Less people maybe not able to help them get to the vaccine sites. Just access to transportation, technology. That's one issue. Another would be just mistrust. You have, from the immigrant communities, we have a lot of undocumented immigrants in Long Beach, and generally just not wanting to have any involvement with, the authorities or government or anything like that. As for example, our Hispanic population in Long Beach, it's 42% of Long Beach's population, huge population, and they're 22% of the vaccines. So that's actually the biggest disparity. So only 22% of the Hispanic population is getting the vaccine right now. And in contrast, if you look at white, is 28% of the population, but 38% of who is getting the vaccines. Black people, another issue, is 12% of the population, but 7% of the vaccine rate. And that's another issue for Black people in Long Beach. There's longstanding mistrust of vaccines, the government, help with, back to Steve Airmen and the syphilis testing of syphilis. So there's a lot of longstanding mistrust and wariness there that is going to be a real challenge for health officials to work past.
Well, and even I'll admit, so I teach a class at Cal State Long Beach, so it didn't even occur to me that I was eligible because I'm an educator, because I've been teaching online now for a year. But I got my first dose, I think, last week. And I'll even admit I was a little wary just because I've been hearing that there are, people have been get a little ill from the vaccine, which I know is normal.
I have friends really sick from the second one. Yeah, friends sick, but goes away in 2 days. But yeah, it's a little concerning. I mean, people have been getting.
Yeah. I know. I got the Pfizer. So now we have Moderna, we have Pfizer, with both require 2 shots, and then we have, how much of the Johnson & Johnson do we now have?
I'm not sure. I know that we were getting it, and they haven't given us a number on that. I think there was some. It's not a large quantity because I think there were some issues with, jurisdictions not getting as much as they thought they were going to get.
I think initially, our first shipment was about 5,000 doses, but that'll be huge when we get more shipments of Johnson & Johnson, I think.
And that's been an interesting issue too. LA Times had an interesting story on that because they're trying to rule Johnson & Johnson out into some of the harder hit communities, with these targeted vaccine sites, and people are saying, well, this feels like a second class shot because it's one shot. It's not as effective as Pfizer and Moderna. So there's been issues with that too. People feeling like they're getting the lesser shot. Yeah.
Interesting. It's about 85% effective. But I think Pfizer and Moderna are in the 90s when it comes to effectiveness.
Well, and the important part is it's 100% effective in saving your life.
Right.
It's going to prevent serious hospitalization and death, or at least it's shown that it has a track record of doing that. I think you're absolutely right. Is that we're at a point now where you have to seek people out, and that I think is where local governments, state governments, and even smaller communities are going to have to step up and carry that message. So we haven't seen how well that's going to work yet. But that is really, after we're past all these logistical hurdles of setting up mass vaccination centers, getting the supply chain in place, it's what is the actual, how effective is it going to be convincing people to actually get the vaccine once people aren't clamoring for it? And Kelly, you wrote a story that I really liked about in Cambodia Town, where they didn't have issues getting people signed up, but it was the infrastructure and getting the word out to those people that seemed to not be working.
Yeah, there's just so many different barriers to getting it to these targeted communities. In Cambodia Town, they have been asking to get the vaccine, to have vaccine at their clinic there, and they weren't able to get it from the city. They said they had to actually go through the federal government, and then the city did eventually set up a vaccine site there with about 300 doses, and then about 3 days before they were set to have this site, somebody from the city called up one of the Cambodian community members and said, we don't have enough people on staff to call all these, it was for Cambodian seniors, to call all these Cambodian seniors to come down on Monday and get their vaccine, because you can't just send out an email. These are Cambodian, most of them do not speak English. They're refugees from Cambodia. And so the language barrier is there, and the city hadn't prepared for something like that. And to have somebody on staff to call 300 people So the Cambodian community activists just banded together and worked this. They found out on a Friday and they worked all over the weekend calling Cambodian seniors and getting people down there. And they were actually able to get 300 people down there. And then the city had some surplus. I think it was like an extra 100 surplus. And so they got 100 more people down within like a day with that day. And so sometimes it takes these community groups, it falls on their shoulders to really work within their community and get that. There's just a lot of barriers there. And I know in the Black community, the city's been trying to work with, they've had two targeted vac sites and been working with the local churches there to kind of spread the word and hopefully, work with some of that mistrust there. But it's a challenge.
And Jeremiah, you've been handling a lot of our schools coverage. So talk about kind of a plan to open schools, and vaccinations was a big topic in negotiations with the teachers union. That's been kind of an issue everywhere around the country. So talk about that process and what the school district has planned.
Yeah, there's been this dance going on for a while between teachers unions across the state and the country about when should we open up. And what it eventually came to kind of a head here in Long Beach, where the school district has been saying, we're ready to go, we're ready to go, we're ready to go. But all of these plans have been contingent on teachers, essentially. And there was a point when, I can't remember ever seeing this before, but the superintendent of Long Beach Unified and 5 of the other biggest school districts in the state actually wrote a letter to the governor saying, essentially, you have to take the power away from us. Until you set a standard that says at this point, schools must reopen, all these different groups, whether it be teachers, whether it be community groups, whether it be school boards, whether it be superintendents, somebody's going to have veto power over that, because you're never going to get all of these people on the same page. And so they said, you have to make the decision, not us, because we can't be the bad guy here, essentially.
They've never opened.
And that didn't happen. What happened was the vaccine arrived, and teachers were able to negotiate that they were going to get an opportunity to be vaccinated. At least here in Long Beach, they said, we want an opportunity to be vaccinated before we're required to go back to the classroom, which that makes sense. There are plenty of teachers who have legitimate health concerns who I can see being terrified to be forced to be around people if you really do have legitimate health concerns. So Long Beach, because it has its own health department, was able to essentially prioritize teachers. So they could literally say, we're taking this chunk of vaccines and we're just giving them all to teachers. So that's part of why they were able to vaccinate educators. And I shouldn't say just teachers, I should say educators, because it was all school staff. Anybody who was going to be on the campus with kids or working with other people got vaccinated. But they were able to take all the vaccines they needed, put those people essentially at the front of the line and say, okay, this 2 weeks, we're just doing them and get it out of the way. And that kind of broke down that last barrier. And now we're on a path where elementary schools are scheduled to open the 29th. And then the following month, middle schools and high schools are scheduled to open on different varying dates. But the one thing that really kind of struck me with that process is, just like with vaccines, just like with case rates, we're seeing disparities there too along racial lines. It's amazing how COVID has exposed every bit of that throughout our society, the haves and the have-nots. Whereas when they announced they were opening elementary schools, the students that were more likely to go back to school were the kids at more affluent schools and kids where there's schools where there's more white students. So if you went to Naples Elementary, it's 70-75% of kids going back, and that's in a very well-off, predominantly white area. But if you go to Lincoln Elementary in Cambodia Town, where the vast majority of students are Latino and the vast majority of students are low socioeconomic status, the percentage of students returning to actual in-class education is much, much lower.
See, I'm confused on that, because I would think it would almost be the other way around, because kids in the low income areas, and parents who are essential workers that can't afford to stay home with them. So I think they would be more in school, where kids in affluent areas, they can afford to stay home with their parents.
Exactly. And that's been a talking point. Whereas like the way to help communities that need help is to get schools open so that kids have somewhere to go, and their parents can go to work. But there's a couple things going on here. Part of it is schools, at least for the rest of this school year, are only opening for half days. Elementary schools are. Middle and high schools are opening longer, but elementary schools are only open for half days. So if you're a working parent and you have to work 8 hours at your job and you have to actually be on site at a warehouse or a grocery store, how do you drop off your kid for 2 hours, then come pick up the kid 2 hours later and still go to work? So if you are an office worker who is able to work from home and do that, you probably have a better chance to be able to drop off your kid for 2 hours and then come back and get him. The other issue is there's not very much time left in the school year. So there's probably parents who are saying, why am I bothering to send my kid back to school for just a few weeks? And then
I'm like, why all this push to get them back when school's going to be done in like a month anyway? Why not just start in the fall? I don't know. I didn't.
And then there's the last factor here that kind of connects back to what we've been talking about before is the poorer areas, the areas with more people of color, Latino people, Black people have been harder hit by the virus. More people have died. More people have been hospitalized. More people have gotten sick. When you go to East Long Beach, it's very, much fewer people have died from this, have had serious impacts of this. So people in the poorer, less well-off areas may be more reluctant. They may be more scared to send students back to school just out of fear. And that's something that's actually been brought up by some school board members, basically saying, my constituents are still extremely worried of this. They've had personal experiences with this. They don't feel safe having their kids back in class like this. So there's a lot of things. We don't know definitively what is keeping people out of class because we just don't have that data. But there's a lot of factors that could be going into that.
Interesting.
And Long Beach was kind of Long Beach really was, I believe, the first school district in the state to reach an agreement with the teachers union. And the mayor here kind of said, we're vaccinating teachers before they have to go back to the classroom. And that kind of opened the door to other, I think, teacher groups across the state saying, we want the vaccine before we go back. So Long Beach has made their way through most educators, at least the ones who want the vaccine. They've had a couple special vaccine events for food workers. At least, we need to follow this issue on the dock workers, because I know that at least 3,000 to 4,000 shots were made available to dock workers as part of that food worker group. And then obviously seniors over 65, the majority have been vaccinated or all have been offered vaccine at this point. So now we're into people with underlying health conditions and people with disabilities. And then I think then we move into tier 1C, they're calling it, which is what? It's communications workers, other government workers.
Government work, our group, media.
Very important group.
It's interesting though. I think what you've been seeing is like these groups are, when you actually get into a group, you realize how, I don't want to say ill-defined, but how much wiggle room there is for those definitions. For instance, like, dock workers were allowed to be under the category of food industry workers because the argument is, well, they're critical to getting food industry equipment to where it needs to go. But other groups, Melissa, you found this out, like truckers, they weren't included in food workers, even though they were transporting those same goods. So there is actually so much, you have this kind of broad framework, but there's so much individual decision-making that goes into who gets it and when. And it's almost like you kind of have to have the influence in the right place if you're looking to get your group to the front.
And the savvy of doing it. I mean, I've known people that were able to sign up and get it, under different, just checking a box, and then they don't check at the back sites. I've had several friends go who were eligible but saying, they didn't check to see if I was eligible or anything. They just asked for my ID and I was in. So
we actually, it was interesting. We kind of there was some incentive for a while for that to actually keep happening, for Long Beach to actually let ineligible people through, because there was a hole in the state's appointment booking system where people could basically sign up even though they weren't eligible. If you just check that box, like you said, Kelly, you could show up at the vaccine site, and theoretically that's where they would ask you for documentation proving you are qualified. But Long Beach was turning so many people away who had signed up improperly that they had leftover vaccines at the end of the day. Yeah. So some people were just being let through because, well, we have the vaccine, we can either have it sitting here or we can get it in someone's arm. And then shortly after Long Beach started running into problems like that, they started doing no appointment needed events. So like they started having this leftover vaccine. So they'd say, okay, food workers, if you're a food worker, just come on down. You don't need an appointment. We'll just vaccinate you. So it's definitely, there have been definite bumps. I think most people in the health industry are thinking, as long as we are vaccinating more and more and more people, at least we are getting to the end goal.
It's brought up a lot of interesting ethical issues. And I think it was New York Times even had an interesting article, like interviews with ethicists, like college professor talking about the ethical issues of, well, I'm not eligible, but there's vaccine going to waste. Would it be ethical for me to pay this? I know many people have had that opportunity, just knowing people, and it's like, well, if it's going to go to waste. And so the ethicists said that if it's something that's going to go to waste, even though it's not, it's ethical. But if it's not your turn and you get something that's probably wouldn't have gone to waste, or that that would not be. But yeah, it's just kind of interesting to see what some of the issues it's brought up.
Right. Yeah, and that's always the point that I found interesting, was kind of the ethics of, are you taking an appointment away from somebody, or are you simply using vaccine that would have gone to waste? Because I don't think we want any vaccine to go to waste. But now, Jeremiah, back to your point, we are kind of entering a different phase, where I think the vaccine is going to be less scarce. It's going to be less of a scarce resource. Because I always sort of laughed. I mean, there's a bunch of groups that are in phase 1, tier 1C. It includes media, includes other government essential workers. It was supposed to include transportation and logistics, but I think a lot of truck drivers and longshoremen, but even truck drivers now are getting some access to vaccine. But this huge group of people with underlying health conditions, I always laughed. I just thought, even though we're in the line after them, that's such a massive group.
Yeah.
Because, I mean, being overweight is an underlying health condition. Having diabetes, having type 2, having eyesight issues could be an underlying health condition. So they're not really.
It's BMI 25 or higher, and that's
just overweight.
Yeah, that's the majority of the population. I mean, we're Americans. Right. We're all most of us are overweight. So I mean, that's right there. I mean, that qualifies.
And like I said, they're not really asking for documentation. They're just asking you to make an appointment under that designation and show up. So we're still at a phase where you have to make an appointment. We're still seeing some glitches like we saw this week, where there's just not enough vaccine for the number of appointments that have gone out. And all in all, though, it's been a pretty amazing logistical feat.
It really has. And Long Beach, and that's another thing to give Long Beach credit, because we really took a gamble. We threw the dice with this process, because Long Beach did a unique process where the city chose to use all of its vaccine when it got it, as opposed to like LA County would reserve some doses for the second dose for people, where Long Beach is like, let's just get this in as many arms as possible. And it was a huge gamble, because at one point we didn't know how much or more vaccine we were going to get. So there was a chance that Long Beach would have seen, if there was a major shortage, a lot of people wouldn't be able to get their second shot. And so it was a huge risk that the city took, but it paid off because it came through, and Long Beach has been able to move a lot faster than most any other jurisdiction in the state, I believe.
So as far as the timeline, where, we're, as we mentioned, we didn't really explain this here because we're not really talking, we're talking mostly about vaccines, but we're now in what the state is calling the red tier, which means we can have some more business openings. Movie theaters can allow some opening with limited capacity. Restaurants can have indoor seating. Gyms and fitness can have some indoor activities, one-on-one personal training. We're kind of at an interesting phase now. It's a night and day. It's interesting that it's all happening in March. March 2020 and March 2021 have been really the big news months, because last March, a year ago, it was all about the closings. Everything was just shutting. And now we're in this phase where we're slowly, cautiously reopening. What do the next 3 to 6 months look like, would you say?
Well, it depends whether we hit that plateau of cases. Are we ever going to hit a point where, okay, these are the stats we're kind of stuck at, or is it just going to keep plummeting? Because if it, like I said earlier, right now, we already qualify for the next loosest tier, the orange tier, as long as we don't have any bump in infections. We just have to wait 2 or 3 weeks and we'll qualify for that. And to do that, just to kind of set the stage, to be in the red tier, your case rate has to be right now under 10. To be in the orange, and the case rate is cases per 100,000 residents. So to be in the orange tier, it has to be under 4, and then in the yellow tier, which is the least restrictive tier, it has to be under 1. So that means you can only have 4 people testing positive for coronavirus in all of Long Beach each day to qualify for that less restrictive tier. And to explain just how fast this happened, it wasn't until Monday that LA County and Long Beach had ever been under a case rate of 10, or was it 7? I don't know, either one. But this was the first time our stats were able to qualify us for the red tier. Until then, it always
we were at 5 yesterday, and for a 7-day case rate and a positivity rate of 1.9%. So those are
and if you look at the infection rate graph, you see the huge winter surge of infections, and then it is just as steep on the way down.
How fast it dropped. It's just really, it's such a bizarre, the weird virus that we don't know. But just to see how it surged and then plummeted, it was really fascinating.
And you don't. The question is, what happens next?
Yeah.
Do people who were infected have immunity forever? We don't know. Is there going to be a variant that makes the vaccine less effective? We don't know.
Patty going to be the next super spreader? Because going out, driving by yesterday, I was like, oh man, there's a lot of people.
So I think right now there's definitely a wait and see type of attitude. There's certainly a lot of hope, because this is the first time we've ever been in this position to see the possibility that maybe these restrictions will go away. But also we just don't know. We don't know until it declines enough that it's essentially gone, and we don't know if that's going to happen yet.
Yeah, I know. And I get a little nervous with seeing, stories like Europe is starting to lock things down again in certain areas because the variants from, I hope that we don't have to lock down again. I think that would be so mentally exhausting, not to mention.
Yeah, I don't even know if people would at this point.
I don't know. It's been a tough year.
Yeah.
But we shall see. And so then in the yellow tier is where, so we're very close to orange at this point. I think the earliest we could move into the orange would be in the beginning of April. And at that point, more capacity in retail businesses, more capacity in movie theaters, more capacity in gyms. And then more schools can open, the higher grades, or is that red? I can't remember.
It's red. Higher grades can open now.
Okay, so
room confusion over the tiers and colors, and as you can imagine.
I almost have it memorized, almost, but yeah, you're correct. So the older grades can open now in the red tier, but then yellow is where I think bars can finally open with some indoor capacity, bars that don't serve food. And, we've got theme parks with more capacity. And then, maybe by the fall, we've got conventions back. Long Beach is a huge convention city, lots of hotels. So
I think the way you're going to be able to tell when we're back to normal is like that when that baseball game, when there's a full stadium, when you go to a Lakers game and it's a stadium full of people, or you walk over to the convention center and it's a sea of people actually there. That still feels so far off. And I don't know if that's a mental or emotional thing. But it could happen. It could actually happen.
Yeah. I mean, just sitting here right now in mid-March, thinking that we would be at this point a month ago, to me was unthinkable, because we were still seeing, double-digit deaths every day. Yeah. So who knows? I think one thing this year has taught us is that we just don't know what's to come. Any closing thoughts, Jeremiah, Kelly?
No, just hope things start moving back to some version of normal at some point soon.
Yeah.
Yep. And you summed it up well.
Yeah. Well, I think we'll wrap it up. Thank you for those who listened in and joined us. And we're actually going to be, this session was recorded, so we're going to be also showing this on the Long Beach Post website as well. So thank you. And if you have any questions, feel free to reach out and email us individually, and we'll do our best to point you to resources or answer your questions. All right. Thank you.
Everybody.